Mr. President, I rise today to speak briefly about the American Health Care Act that was passed last week in the House of Representatives. I've thought a lot about this bill over the past few days and over the weekend, and I talked to friends and I read about it and I did as much analysis as I possibly could, given the fact that we don't have a Congressional Budget Office analysis of this complicated and important piece of legislation. But I have concluded that it is the most ill-conceived, damaging, and downright cruel piece of legislation that I have ever seen any legislative body pass in my adult life. It drastically cuts support for Americans' ability to obtain health insurance. In Maine, again, as near as we can tell, because we don't have the final analysis, but the preliminary numbers are this. Maine, under the Affordable Care Act, through the payments to individuals and other supports, is receiving about $354 million a year coming via the Affordable Care Act. After this bill, it appears that the number is $80 million a year, $364 million to $80. That's almost an 80% cut. No one can tell me that the people of Maine are going to have better health care with an 80% cut in the funds going to support their ability to do so. It just doesn't make sense. Also, the way this bill works, it's a tax on the elderly. Under the Affordable Care Act, there is a rule that policies for older people, 50, 55, 60, cannot exceed 3 times the rate of policies for younger people. We all know that younger people's policies do, in fact, cost somewhat less because they tend to be healthier. But the rule was no more than 3 to 1. Under this bill that passed the House last week, it's now 5 to 1. That's an elder tax. And Maine happens to be the most elder state in the United States. If they had taken a blank sheet of paper and said, we want to write a bill to harm the people of Maine, it would have been this bill. There also is a massive cut to Medicaid, $880 billion. And the sponsor of this bill, the sponsors claim they are helping the deficit. They're reducing the deficit. How are they doing it? By shifting the cost to the states. Shift and shaft. Balancing the federal budget by simply taking costs that are now borne by the federal government and passing them off to the states is not responsible fiscal policy. Why not we just have the states fund the United States Air Force? That would save us $400 or $500 million a year. That would save us billions of dollars, probably $100 billion a year. Shift that to the states. $880 billion shifted to the states. And then there's what I call the fig leaf pre-existing condition provision, which talks about the Maine plan, which was a plan that preceded the Affordable Care Act, which did give protection for pre-existing conditions, but it was adequately funded. It cost about $64 million a year to fund our pre-existing plan. Again, because we don't have the precise figures, but it looks like under this new bill, that $64 million would be $20 million. A third as much, 2/3 reduction. It's not a real pre-existing condition plan. It's a fig leaf. It's to say to people, we're covering pre-existing conditions. Nonsense. Not true. And of course, the final piece of this bill is a massive tax cut for the top 0.1% of people in this country. They won't even notice it. But the people who lose their health care will notice it. Now, under the Affordable Care Act, there is a list of essential benefits which includes mental health and substance abuse. That's a big deal. That allows and assures people to have coverage for these very damaging and dangerous, in the case of substance abuse, conditions. Under this bill that passed in the House, states can waive those provisions, and the waiver is very easy. The standards for the waiver are very easy, and if the federal department doesn't respond in 60 days, the waiver is automatically provided. And in those states which they have, when they have a waiver, mental health and substance abuse services could be covered under specialized plans, which would be very, very expensive. And by the way, this waiver covers both the individual market and employer-based coverage. How many people will be impacted? We don't know, because we don't have an analysis from the Congressional Budget Office. Now, I want to talk for the remainder of my time about opioids and what this bill would do to that. We are in the midst of a crisis. It's the most serious public health crisis in my adult life. In Maine and across the country. In Maine, substance abuse overdose deaths. You can see what's happened in the last 5 years. More than one person a day is dying of an overdose. Across the country, it's 4 an hour. We have turned ourselves inside out in this country to deal with the threat of terrorism, for example, which was entirely appropriate. But what if we had a terrorist attack that was killing 37,000 people a year across our country, 37,000 people, and we're just sort of going along business as usual? I've been working on this issue since I got to the Senate. I've been meeting with people throughout Maine in hospitals and meeting with people in recovery and families and parents and law enforcement. And the one thing that comes through loud and clear is that treatment works and that we need it and that we don't have enough available beds in Maine and across the country. This is a terrible disease. But the most tragic thing of all is when someone finally reaches the point where they're ready to ask for help and they're told, sorry, there's a 3-week wait or there's a 3-month wait. That's when lives are lost and families are destroyed. Treatment does work. I've met with people for whom it has worked and changed their lives. I have a friend in Portland named Andrew, I'm going to mispronounce it, Kazoulis. Andrew Kazoulis, who is graduating, I believe, this weekend from the University of Southern Maine, and he's been through this. He's been to the bottom, and he's now on the mountaintop. He knows treatment works. It's made a difference in his life, and without it, he wouldn't be where he is today. Justin Reed, another young man from Southern Maine, who was in the throes of addiction and who has escaped and now runs a sober house and volunteers for a program with a local police department. Access to treatment is much easier with health insurance and with sufficient Medicaid support. The House bill simply makes it more difficult to access treatment. It penalizes the very people who've taken the hard step to say this is what they need. Let me tell you a story. Matt Braun is from Cape Elizabeth, Maine, right outside of Portland. In 2009, Matt entered treatment for opioid addiction. His parents are strong, middle-class, professional people. They'd purchased what they thought was good health insurance for their family. After 5 days of treatment, they received a call that the insurer was not going to pay for any more. We've decided your son only needs 5 days. His parents argued. The medical staff argued. They finally won. They got 7 days of treatment. Those extra 2 days made a difference. The insurance company said, it isn't going to help. He's going to be a chronically relapsing, drug-addicted person, and they were going to stop at 7 days. They said he wouldn't make it. His parents didn't give up. Matt stayed in treatment and has been sober ever since 2009. He is successful. He's getting ready to take the MCATs. He wants to go to medical school. His goal is to approach addiction from the perspective of a health professional, offer care and support to people who are struggling the way he did. It's frustrating how insurance companies, this is from Matt, dictate what treatment looks like and what a life is worth. Getting treatment for substance abuse disorder is not easy, but this bill, the American Health Care Act, What a misnamed bill. It should be the American Take Away Health Care Act, only makes it worse. And on top of all this, the administration has recently indicated that they are talking about essentially dismantling the Office of National Drug Control Policy, the highest level of working on this problem in a coordinated way in the federal government. Here we are in the midst of the most serious drug crisis in the history of this country, and the administration is talking about gutting the very office that's supposed to lead the fight. It's as if in the middle of World War II, we had abolished the Department of Defense. It makes no sense. It's moving in an absolutely the wrong direction. And by supporting this health care bill or non-health care bill in the House of Representatives, which will drastically cut Medicaid, drastically cut reimbursements for health insurance, drastically limit the availability of coverage for pre-existing conditions, and by the way, drug addiction could be one, and drastically eliminate the essential benefits provisions of the Affordable Care Act, we're just making it worse. The Office of National Drug Control Policy has things like the Drug-Free Community Support Program, small grants to small towns that can make a real difference. 18 main programs each received $125,000. And the National 2014 report said there was a significant decrease in 30-day use of prescription drugs for youth in communities with one of these programs. Prevention is one of the things we need to work on. It's one of the things we need to understand. But talking about this problem is not going to solve it. Treatment is going to solve it. Money for treatment is going to solve it. Beds for treatment is going to solve it. Detox centers is going to solve it. More resources to law enforcement is going to solve it. More resources to the Coast Guard to interdict drug shipments coming into this country. There is no single answer. But at the core is commitment. And by passing this bill in the House that drastically undermines all of those elements of treatment and prevention, and then by talking about dismantling the office that has led this fight in the entire federal government, is just, it is beyond comprehension in the midst of where we are. If this graph was doing this, you know, if it was going down, I'd be okay with it. But it isn't going down, it's going up. It's getting worse, and we have to deal with it. So, Madam President, I hope that as we work through, and hopefully we're going to start with a blank sheet of paper over here, as we work through this issue of health care, I hope we bear in mind that one of the most serious health problems in the country today is opioid abuse. And this isn't all about ideology. It isn't about policy. It's about people. It's about Matt. It's about Alex. It's about thousands and millions of people across this country who are struggling, who want to lead productive lives, who want to contribute to their communities. And all they need is to have that moment where treatment is available, where a helping hand is available, where caring is available, to help them to escape the throes of this terrible disease and to rejoin their communities and their families. That's what we have to keep in front of us as we work here in this body. We can make a difference in people's lives, but leaving them behind will certainly not do so. Thank you, Madam President. I yield the floor.